Hi, my name is Andrea Nguyen. I'm here in Las Vegas, Nevada at Derm 2026. I'm a practicing dermatology PA out in California, and I'm very pleased to talk about my sessions here at the conference. The first one we'll highlight today is our poster session update on the first day of Derm 2026. We reviewed a few posters. The first one was looking at a study called Global Spin, looking at dupilumab usage in prurigo nodularis patients. So this was a global real-world study. The data is still ongoing, so we have just preliminary callouts on this, but essentially we have real-world usage of dupilumab in prurigo nodularis patients, where we saw at 3-month follow-up a large percentage of them having good clinical clearance of the prurigo nodularis lesions. So we had just about 77% of patients enroll with an IGA severity score of moderate to severe. To give clinical context, that's anywhere from 20 to 100 lesions in the moderate category, and for severe, that's over 100 lesions of prurigo nodularis lesions are counted by the investigator. And at the 3-month mark, we have just about a third of participants who enrolled that achieved clear or almost clear on the rating scale. So really nice for us to see that confirmed in real world study through Global Spin. The next poster update that we reviewed is one pertaining to acne and compliance or treatment adherence. So this was really interesting for us as clinicians because we always hope that our patients do exactly as we tell them what to do. But we all know, if we have been practicing for any amount of time, that compliance is not always 100%. And what they saw is they reviewed 6 publications or studies looking at compliance or adherence for topical, oral, systemic acne medications, and they saw compliance rates from anywhere from 12 to 65%. So very concerning that we're not super compliant, especially on the lower end. And this was looking at all treatments, whether it was topical only, topical plus systemic, oral retinoids, or oral antibiotics. And what they also did is they looked at a study looking at compliance rates when using topicals. If you were to use a topical in a combination topical, so single application with 3 products, or double application with a combination product and a single agent product, or a 3 application with a single active in each tube. And what they found was the highest compliance rate, and no shocking surprise, was the triple agent in a single formulation. And so that triple agent was a topical clindamycin, benzoyl peroxide, and adapalene product. And they found that they had the highest number of study participants able to compliantly apply medication and achieve treatment success. Now, barriers to compliance that they found through their review of those 6 studies was anywhere from a myriad of forgetfulness to, tolerability issues. Some of it could pertain to cost or fear of side effects. And so there's a number of reasons why patients may not be as compliant as we'd like them to, but the sentiment overall is looking at these studies is that the less complicated of a regimen we give patients, frequently that may help them be more compliant with their treatment for acne. And then the last 2 posters were pertaining to hidradenitis suppurativa. So we looked at Bimzelx in the use of HS patients in the BHERD study. And the first poster we looked at was looking at patients and how they did over time from the first year to the second year to the 3rd year mark. And so what we found is that irrespective of their Hurley staging, patients were able to remain flare-free and have very durable, consistent disease control out throughout 3 years. So that's really exciting for us and our patients. For the first year of use, and really in the first 16 weeks, what we did see is that the higher Hurley staging, so our Hurley stage 3 patients, had a higher incidence or frequency of flare. And we saw that really in the first 16 weeks, and then also carried out through the first 48 or 52 weeks in the first year. But by the time you get to year 2 and year 3, irrespective of whether you had more moderate disease as a Hurley stage 2 or more severe disease as a Hurley stage 3, in years 2 and 3, the flare risk for those patients was very comparable. So that's really exciting for us, especially considering that we know our Hurley stage 3 patients, there's a lot of inflammation in those patients. They suffer quite a bit, and the disease is a lot more prominent. So it's very reassuring for us to see that essentially the longer you are on medication, the two cohorts essentially even out. And then our last poster was looking again at BHERD data in use of Bimzelx in hidradenitis suppurativa patients, but here we looked at sub-analyses. So we looked at difference in age, difference in weight, male versus female, disease duration, prior systemic usage. And what we see is across the sub-analyses of patients that were enrolled in the clinical trial, the medication effects and the control of disease was very comparable across the subgroups. So that gives us the reassurance that, irrespective of what patient type we may have, they are likely going to have pretty comparable response to this medication as we saw in their clinical trials. The other thing that they looked at was high score achieving. So in the first year, the majority, pretty much 90% plus of study participants were able to achieve high score 50, which is a really meaningful clinical endpoint. When we raise the bar, though, to high score 90, which is an incredible amount of inflammatory reduction in active nodules and draining tunnels, we saw that a good portion of patients achieve that in the first year. But if you give them a little bit more time in getting into year 2, then the majority of patients had achieved high score 90 by the 2-year mark, and a small percentage out to the 3-year mark. So essentially, the sentiment behind that may be that the longer you are on therapy, the deeper of a clinical response you may have. So it's again really exciting for us, some wonderful poster updates, and I hope the attendees took a lot away from it.